This episode of Doc Talk is brought to you by the Kappa Boot Scootin' Ball, featuring the president of the Redneck Yacht Club himself, Craig Morgan. Join us Friday, April 5th for the Knoxville's most talked about fundraiser of the year. The event will be packed with great country music provided by Craig Morgan, line dancing, Western-themed dinner, bottomless beverage, and an exclusive Kappa Boot Scootin' Ball souvenir mug. Additionally, a silent auction valued at more than $40,000. You have the opportunity for those in attendance to bid on some packages, including a Dynasty Spa. For tickets, visit kappabootscootin.com.
Hi there, welcome to Doc Talks. Doc Talks is the podcast that talks in plain language health issues affecting all East Tennesseans. Welcome, I'm Elise Denaney. I'm former president of the Knoxville Academy of Medicine, and joining us today is Dr. Eric Penniman, family physician first and executive medical director of Summit Medical Group, one of the largest primary care groups treating all diseases affecting East Tennesseans. So today our topic is hypertension. First of all, welcome.
Thank you.
Now, what's hypertension?
Yeah, hypertension, otherwise known as high blood pressure.
High blood pressure.
Most people know about that, and they know that they can get it measured by putting a cuff around the arm, and you listen to see when you can hear the sounds that go along with what your blood pressure is. So, yep.
Okay, so blood pressure. When I see my doctor's visit and I see blood pressure on the record, it says BP, and then it has one number and a slash and another number. What is that?
Yeah, so the top number is called the systolic blood pressure, and that's the pressure when your heart contracts. And there's an initial bolus of blood or a large amount of blood that pushes through the arteries, which stretches the arteries, and that's your systolic pressure. The diastolic pressure is the pressure when your heart is at rest. And so that's why that number is lower than the top number is.
Okay, so is there a normal blood pressure?
Yeah. We know from years and years of research and studies that blood pressures generally below 140/90 are considered okay. Now, most ideal would be 120/80, and there's still debate even to this day whether or not we should try to treat people down to 130/85, but we know that as a person gets older, a slightly higher blood pressure is acceptable. So it depends on how old you are and if you have any other illnesses such as diabetes, which then we know that we need to be very careful to properly treat a person's blood pressure.
So many questions. Okay.
Yeah.
So before I go to the I get older. It's okay if my blood pressure gets a little higher because my arteries get old?
Yeah, that's a great way of saying it, because as we get older, our arteries loses their stretchiness.
Great.
And when they're less stretchy, yeah, everything else gets more stretchy, right? But unfortunately, our arteries get less stretchy, and when they don't stretch, the same amount of blood has to go through a more confined space, so the pressure goes up. And so that's why a little bit higher blood pressure as a person gets older is a normal thing, and you don't necessarily want to treat it.
Okay. What's the big deal? So what if my blood pressure is high? Is that bad?
Yeah, it's really bad. We know that it's a top risk factor that accelerates early heart attacks, strokes, kidney disease, kidney failure, other blood vessel disease that can lead to foot amputations, and there's just such a variety of problems that high blood pressure causes that it's really one of the most important, what we call modifiable risk factors. So it's something we can do something about. Having a family history of a heart attack, you can't do much about that, but we can do a lot to try to prevent the heart attack by controlling blood pressure, controlling cholesterol, making sure your blood sugars stay under good control, those types of things.
Wow, okay. So how, other than medication, what else can I do as a responsible person who wants to take care of my health to keep my blood pressure good?
Yeah, so there's really 2 or 3 things that we tell every patient when we tell them they have hypertension. 1, try to change your diet. There are some diets known as the DASH diet is one of the most popular that reduces the amount of salt, increases the amount of fruit and vegetables that has been shown to lower your blood pressure. But in general, weight loss, any diet that helps you lose weight will bring your blood pressure down. And so weight loss will help. And then even most important is exercise. And long heart studies have shown that 150 minutes of mild to moderate exercise per week will prolong a person's life better than any other intervention that we can do. So once again, exercise is extraordinarily important.
I love that you said mild to moderate. So I don't have to get dressed up in a workout suit and go beat myself to death somewhere.
Right.
I can just take a walk.
Yeah, especially in Tennessee. Going for a walk in Tennessee is moderate exercise because it's up and down hills. I moved here from Wisconsin, and that was much flatter. So.
Okay, that's good to know. All right, so will I have symptoms if I have? Will I, know that I have high blood pressure?
And that is a great question, and we refer to hypertension as the silent killer because most people have no symptoms whatsoever, and so unless you're measuring it, you have no idea that you have high blood pressure. And so you got to go in, get a physical regularly with your doctor, which if you have any sort of health insurance, physicals are covered at 100%, so there's no cost to patients, and you can get your blood pressure measured and make sure that you don't have hypertension or high blood pressure.
Okay, this is going to sound crazy, but are those blood pressure cuffs that you see at the drugstore and at the grocery store, can we use those?
You can. Of course, there's the ones you can buy over the counter, but then they have the little booth that you can sit in Walmart or Kroger's, one of those places. But the key there is when you check your blood pressure, oftentimes folks are not checking it properly. And a person should be sitting comfortably, relaxed, both feet flat on the ground, their back comfortably resting against a backrest, arm at heart level when it's measured. And so most people don't take the time to actually sit in the booth for 5 minutes before they check it. They're busy shopping and, I got to grab the toothbrush and, here, I'll sit down and put my arm in the machine and, it's 160 over 100. I better go see the doctor, So yeah, that's the hard part about the little machines in the drugstores. People don't take the time they really should to get a good measurement.
Okay. Why is my blood pressure always higher when I go to the doctor?
So a lot of people, in fact, 25 to 30% of patients have what we call white coat hypertension, which just means you go to the doctor, the stress causes the little muscles inside your arteries to tighten, the measured blood pressure then is higher. And so the research has really made it very clear the most important blood pressure is the blood pressure that the patient has outside of the clinical setting. Because you're only in the doctor's office, hopefully, not more than about 0.5% of your life, right? Hopefully you don't have to be there that often. So, we want to know what is your blood pressure when you're not at the doctor's office. So that's where home blood pressure monitoring and ambulatory blood pressure monitoring can be very important.
Okay. There's just a lot of different drugs that can treat hypertension. Why are there so many different kinds?
Well, there's so many different reasons why you have hypertension, and the different drugs work to lower your blood pressure in a different way, such as ACE inhibitors or angiotensin converting enzymes. Inhibitors, they work within a enzyme and a hormone at the kidney level to reduce your blood pressure and relax those muscles around the arteries. Calcium channel blockers work both with the heart as well as with the muscles around the blood vessels. Beta blockers work mostly on the heart muscle, and so they have different mechanisms. They all can work, and that's why oftentimes a person with pretty high blood pressure needs to be on 3 or 4 meds. We need to really help regulate all the different factors causing the high blood pressure.
Okay, that explains a lot. And sometimes when neighbor Mrs. Brown says, well, why did your doctor put you on such and such? Because that's what I'm on for my hypertension. It's because my hypertension is not the same as your hypertension.
That's right, yes. And we also know that, for instance, if you're of African, if you're African descent or, even from the Caribbean, they tend to respond better to like hydrochlorothiazide. It's a type of water pill, and bring it down. So some of the ethnic differences also will cause us to choose different blood pressure medicines, because we know that certain ones work better in African Americans versus Middle Easterners versus somebody from Asia versus Anglo Americans.
One of these days we're going to be able to take your genetics and know what's the best medicine instead of trying to figure out
Yes.
Is it door A, door B, or door C?
And we're really close to that right now, actually, with precision medicine. But that'll be a topic for another podcast.
Oh, I think it's great. We need to do
Yeah.
precision medicine. Okay,
Yeah.
so take the medication. Sometimes it takes a little short, you'll know pretty soon, or sometimes it takes a little longer.
Yeah, usually we say it takes a week or two for the blood pressure medicine to really begin working. So most of the time we're having people follow up at 2 weeks, 4 weeks to see if the medicine and the dosage adjustment is working.
So if I try the medicine and I get really dizzy,
Yeah.
what should I do? Should I stop it or should I?
Yeah, don't stop it.
Stay with it.
Drink more water. Give us a call. Oftentimes, maybe we start at too high of a dose, and a lower dose you'll tolerate well. Oftentimes, when you start meds, if you start out at a low dose and slowly increase, people tolerate it well without side effects. And so that's sort of the art of medicine in knowing how fast to try to bring somebody's blood pressure down. And so you can definitely bring someone who's had very high blood pressure down too quickly, and they're going to feel terrible. And so you have to do it in a nice and slow and kind of a systematic approach.
Well, I love that. I love that you said the art of medicine because, I can look at a textbook and I can go 2 and 2 is 4, but I also know that you're Mrs. Brown and I know that your body behaves this way when I start a certain medicine. And that special relationship that I have with my family physician is going to keep me in that safe zone so my blood pressure doesn't go too high.
Yes, exactly.
Good.
Yep.
Is it bad to be too low too?
It is, yeah. Number one, just quality of life. You stand up out of a chair and you're dizzy and you feel like you're going to pass out. And the last thing an 80-year-old patient needs is to pass out, fall over, and break her hip. And so, yeah, it can definitely be too low. And so if you're symptomatic when you stand up quickly, it's probably too low. Otherwise, if you have no side effects with your very low blood pressure, that's perfectly great. And it'll probably serve you well in the long run.
Okay, that's good to know. Well, there you have it, hypertension. It is sometimes simple, sometimes complicated, sometimes it's difficult to bake the perfect Hershey bar cake.
Yeah.
But it is important that you stay with your family physician who knows you so well so that they can get that perfect combination necessary to keep your blood pressure under control, that you can enjoy an excellent quality of life. So if we need to get a hold of you or find a family physician, how can we do that?
Yeah, the best way to see one of our Summit Medical Group doctors, and we're in 14 counties all over East Tennessee. We have 60 different offices, is to go to our website, summitmedical.com. There's a menu up there for locations. You can choose the county you live in and see which doctors or nurse practitioners or physician assistants that we might have in your area. And you can read about them and choose one, and then the phone number will be right there to call.
Excellent.
This episode of Doc Talk is brought to you by the Kappa Boot Scootin' Ball, featuring the president of the Redneck Yacht Club himself, Craig Morgan. Join us Friday, April 5th for the Knoxville's most talked about fundraiser of the year. The event will be packed with great country music provided by Craig Morgan, line dancing, Western-themed dinner, bottomless beverage, and an exclusive Kappa Boot Scootin' Ball souvenir mug. Additionally, a silent auction valued at more than $40,000 will give the opportunity for those in attendance to bid on some packages, including a Dynasty Spa. For tickets, visit kappabootscootin.com.